What is type 2 diabetes? Diabetes. Diabetes or diabetes mellitus is a condition in which blood sugar is too high. Diabetes comes in two forms, type 1 diabetes and type 2 diabetes, also known as adult-onset diabetes. In type 2 diabetes, your body cannot make or use insulin well. Insulin is a hormone that allows glucose, sugar, to enter and fuel cells. Without insulin, too much glucose builds up in the blood leading to diabetes. Over time, high blood sugar can cause serious problems in your heart, eyes, kidneys, nerves, gums, and teeth. Common symptoms. Signs and symptoms of type 2 diabetes. Fatigue is a sign of diabetes. Signs and symptoms of type 2 diabetes are often absent or so mild that you may not notice them for many years in the early stages. Common symptoms may include blurred vision, tired, eat a lot but still hungry, drink a lot of water but still get thirsty, frequent urination, especially at night, wounds take a long time to heal, pain and numbness in the legs or arms, unexplained weight loss. When do you need to see a doctor? If you have the signs and symptoms mentioned above, or have any questions or concerns, consult your doctor. The location and medical condition can be different in many people. Always discuss with your doctor to determine the best method of diagnosis, treatment, and management for you. The cause to the illness. Improper eating causes obesity. Type 2 diabetes is caused when fat, liver, and muscle cells do not respond appropriately to insulin. This condition is called insulin resistance. As a result, glucose cannot get into your cells to help you store energy and leads to high blood glucose levels causing hyperglycemia. According to Healthline, causes of insulin resistance include being overweight or obese. Too much fat and calories can make it difficult for your body to use insulin properly. Genetics, as with type 1 diabetes, family history, and genes also play a role in causing type 2 diabetes. Risk of getting. People who often have type 2 diabetes. Pregnant women prone to diabetes. Type 2 diabetes is the most common form of diabetes. Among people with diabetes, about 95% have type 2 diabetes. Any age can get type 2 diabetes, including children. However, the disease most commonly occurs in middle age and old age. In addition, people who are obese and sedentary are also more likely to develop type 2 diabetes. What factors increase the risk of type 2 diabetes? Factors that increase the risk of type 2 diabetes include weight. The more body fat you have, the more resistant your cells become to insulin. Sedentary. The less active you are, the higher your risk of type 2 diabetes. Physical activity helps you control your weight, uses glucose as an energy source, and makes cells more sensitive to insulin. Family history. Your risk is increased if a parent or sibling has type 2 diabetes. Race. While it's still unclear why, certain ethnicities including blacks, Hispanics, Americans and Asian Americans are at higher risk. Age. The risk of the disease increases as you get older. This may be because you tend to exercise less, lose muscle, and gain weight with age. But type 2 diabetes is also increasing dramatically in children, adolescents, and young adults. Gestational diabetes. If you had diabetes when you were pregnant, your risk of prediabetes and type 2 diabetes later increases. If you have given birth to a baby weighing more than 4 kilograms, you are also at risk for type 2 diabetes. Polycystic ovary syndrome. Women with polycystic ovary syndrome, a common condition characterized by irregular menstrual periods, rapid hair growth and obesity, increase their risk of diabetes. High blood pressure above 140/90 mm/Hg, is associated with an increased risk of type 2 diabetes. Abnormal cholesterol and triglycerides. If you have low high-density lipoprotein, HDL, or good cholesterol, your risk of type 2 diabetes increases. Triglycerides are a type of fat found in the blood. People with a lot of triglycerides have a higher risk of developing type 2 diabetes. Your doctor can tell you what your blood cholesterol and triglyceride levels are. Effective treatment. The information provided is not a substitute for medical professional advice. Always consult your doctor. What medical techniques are used to diagnose type 2 diabetes? Diagnosing hyperglycemia. Your doctor can diagnose type 2 diabetes through the following blood tests. Measuring blood sugar fasting. Glucose tolerance test. Hemoglobin A1C test. Random blood test, without fasting. If you have been diagnosed with diabetes, you'll likely need to see your doctor every 3 months, so he or she can check blood pressure, check the skin and bones in your legs. Check if your legs have become numb. Examining the back of the eye with a special light tool. Have a hemoglobin A1C test every 6 months if your type 2 diabetes is well controlled. These tests will help you and your doctor control the progression of type 2 diabetes and prevent possible complications. In addition, you should also perform the following checks annually. Have your cholesterol and triglyceride levels tested every year. Visit your dentist every 6 months to prevent dental complications. Get tests done to make sure your kidneys are still working properly, like tests for microalbuminuria and creatinine ratio. What treatments are used to treat type 2 diabetes? Symptoms of diabetes. Many patients control their diabetes with diet and exercise. New dietary regulations allow for more food choices. But avoid foods high in sugar and fat, this is very important. Exercise helps to control weight and keep sugar levels low and the body to use insulin better. However, for some patients, diet and exercise are not enough, they also need to take medication. Type 2 diabetes medications are usually drugs that help the body use glucose better. Some common medications include alpha-glucosidase inhibitors, biguanides, DPP-4 inhibitors, injectable medicines, GLP-1 analogs, meglutinides, SGLT2 inhibitors, sulfonylureas, thiazolidinediones. If these medications don't work, you'll need insulin injections to help control blood sugar. Insulin cannot be taken by mouth because stomach acid will destroy it, so it must be injected under the skin. Blood glucose levels need to be checked often, usually at least once per day. In addition to the care of your primary physician, there are specialists, endocrinologists, podiatrists, and ophthalmologists, to help prevent diabetes complications. Suitable mode of living. What lifestyle habits help you limit the progression of type 2 diabetes? You can manage your condition well if you keep a few things in mind. Keeping blood sugar levels close to normal. Exercise and eat right. Keep your weight in the normal range. Eat enough meals. Eat healthy, high-quality whole grain foods, fruits, vegetables, and protein. Avoid foods high in sugar, fat and white flour. Minimize the use of alcoholic beverages. Annual eye checkup and dental checkup every 6 months. Quit smoking. Take good care of your feet, you should visit your doctor every 6 months. Go to the hospital right away if you have a fever or vomiting and can't eat or drink. Go to the hospital right away if you have abnormally high or low blood sugar. No smoking. Do not drink strong alcohol or solutions with a lot of sugar.